COVID-19 testing sites like this one could turn into mass vaccination centers once a vaccine is available. A notice the CDC recently sent to states lays out a timeline that seems to some doctors rushed.
The federal government says state health departments should get ready to start distributing a coronavirus vaccine by November 1st. That timeline is sooner than what Dr. Anthony Fauci, the nation's top infectious disease doctor, says is realistic.
I believe that by the time we get to the end of this calendar year, that we will feel comfortable that we do have a safe and effective vaccine.
The federal notice to states is raising concerns among some health officials that the Trump administration is trying to rush a vaccine or generate buzz about one right before Election Day. Federal officials have said the first doses may be given under an emergency authorization before the vaccines finish clinical trials.
We as public health folks need to stand up and say that the usual processes need to be followed, and that's what we expect.
Washington Secretary of Health Dr. John Weisman pushed back on the federal expectations Wednesday, saying the influence of politics on a vaccine timeline will only erode people's confidence in the medical system.
And we stand firm that any vaccine that is used for COVID-19 has to prove safety and efficacy standards.
Weisman says Washington state is currently building up an infrastructure for mass COVID vaccinations, including systems for ordering, receiving, and tracking millions of doses. But he says he won't be comfortable administering those until a vaccine has been thoroughly tested and independently reviewed.
Once a safe vaccine is available, the state says medical workers, first responders, and people in fragile health will be first in line to get it. In Seattle, Ted Land, King 5 News.